This video is called How to Do the Optimal Score, or the Optimal Scale. This is the Optimal Outpatient Physical Therapy Improvement in Movement Assessment Log. It's owned and copywritten by the American Physical Therapy Association, and you have to contact them before you use this, which I have, and gotten written permission to use this and teach my staff how to do it, and that's what this video is for, is to teach my staff. At any rate, I filled in the name of a patient up here at the top, Jane Doe, and I put the date, today's date. And then this is a sort of a sample, one that is fairly representative of our geriatric patient population, and they filled it out according to these are level of difficulty and confidence in performing these functional activities: lying flat, rolling over, moving. This list of 21 of these here, which is probably not comprehensive, but it's fairly complete. There's a couple on here that I don't use a lot, like running, and there's one on here that I'd like to see, such as just standing still, perhaps at a counter to prepare food. So a couple of people have added that on, and that's fine. That's totally appropriate, because this isn't peer-reviewed research. This is clinical. You're also free to use your own instrument. You don't have to use the Optimal, but Medicare requires that we measure both impairments in range of motion and strength, as well as functional limitations. So the Optimal is an excellent tool as far as I'm concerned. It's standardized, it's national, and it's recognized by Medicare. Once they fill this out, first step is make sure they haven't skipped any lines. Okay, if they have, then have them fill out the not applicable. Then we take the sum of each individual score and we come down here to the bottom. Let's just make sure you can see that. Okay, get you down there a little bit closer. And I've written in pencil, unfortunately. Sorry about that. Don't do this in your charts. We have a 3. 5 times 2 is 10. 3 times 4 is 12. 2 times 4 is 8. And 7 times 5 is 35. This is a pretty typical Optimal scale for our geriatric population. Looks like this lady may have had something going on with her knee or lower extremity. Her total score, which you probably can't read that, there you go, 68, and then you put the bottom number, which I think that's the denominator, is 21. That's the total number of, see that there? Total number of functional limitations or functional activities. So 68 divided by 21 is 3.24. I do carry it out to 2 decimal places. Maybe that's not statistically correct, but it helps us show improving trends. Now, here's probably the most important part for goal setting of the Optimal. Okay, from the list above, choose the 3 activities that you would most like to be able to do without any difficulty. For example, and then it goes on. Now this person has selected number 8, kneeling, number 10, walking long distances, and number 12, climbing stairs. I would go ahead and set those as functional goals in the Medicare plan of care. So for number 1, it might read improve kneeling from a, I don't know if you can see that up there, a 4/5, and then using my skill and judgment, I might say I believe she's capable of getting to a 2/5 for kneeling. Okay, and that would be an example of goal setting using the Optimal. You might include some information such as comorbidities. Maybe she also has spinal stenosis, and for that reason you think she's only capable of a 3/5 for kneeling. But that, in a nutshell, is how to use the Optimal scale to assess functional disabilities at baseline and to begin selecting your goals for your Medicare plan of care.